Hello, everyone. It's Wednesday, August the 5th. Very reluctantly, I hate like crazy to start off and tell you we've lost seven more additional West Virginians. Our 118th death was a 70-year-old male from Preston County. 119th death was a 55-year-old female from Taylor County. 120th was a 68-year-old female from Kanawha County. The 121st was a 73-year-old male from Marshall County. The 122nd was a 92-year-old male from Grant County. 123rd was a 43-year-old male from Mingo County. And the 124th death was a 91-year-old male from Wood County. Now, before I go any further, I would just tell you just this. Look at all these different counties. There's no two in one county. And what does that tell us? It tells us that this killer is amongst us all over the place. And we've got to do any and everything we possibly can to slow the virus, to slow the killer, in order for us to be able to get to that medicine that suppresses or the medicine that is the vaccine that stops. Now, all these people don't need to be a number. I've said it over and over. Please love these families and love these people. They have contributed so much to us, it's unbelievable. The sadness for these families and these loved ones is off the chart. There's no way on earth I'm going to be able to say, or would ever sit here and say, I know what you're going through, because we don't know what they're going through. Whatever it is probably not very good. So please keep them in your prayers. Absolutely, as Kathy and I will, and we absolutely ask you to do the same. Now, as far as our numbers go, we've lost 7 people today, which is beyond horrible, but the numbers themselves may even be a little better. We've had 103 new positives today, which is way too many, but it's still better. We're testing a ton of people. Now we have tested in West Virginia 302,443 people. We're approaching 20% of our entire population. We have absolutely surpassed 1/6 of our population, and now we're gunning toward 1/5 of our population. Now, the active cases today, the daily positive number today is 2.55. Our cumulative number is 2.37. From the standpoint of active at 2.55, that's down below that 3% line, and that's good. You know, we've been bouncing above that 3% line too much, way too much. Now, the total number of active cases in West Virginia is down to 1,817 from 1,938 on Monday. The total hospitalized has dropped, to 115 from 116. It's not much, but at least it's not gone up. And the counties that are seeing the highest rates of increases are Logan, McDowell, Mercer, and Grant counties. I'm awfully concerned about the southern counties from the standpoint of this migration north of this terrible virus. And although our numbers, surely from the standpoint of a comprehensive basis are significantly better than any of the states that are surround us. In fact, it is amazing what the situation is comparing West Virginia to others. But the good news is today the numbers on a daily basis are somewhat better, and the active cases are better, and the hospitalizations have, at least for this moment, stopped this 10%, and they've even backed down one. So that's good. Our RT or R naught level is the lowest that it's been in a long time, and it's at 0.96 today, and that's really good also. So there's some good news in the middle of the storm. Now, if I could get on to the biggest news of the day, I want to walk you through the entire reopening of the school plan. Now, I want you to know that without any question, I've told you repeatedly, there's no chance in the world, to the very best of all my abilities, will I absolutely put a kid, a teacher, a service personnel person, or anyone into a situation that I feel is unsafe. Today I am extremely proud to announce that we have safe methods to reopen our schools that we built in from a standpoint of local control and scientific metrics. We will begin education for all of our people, all of our kids on September the 8th, provided one thing doesn't happen. Provided we all know just this simple thing, that this situation is absolutely fluid. It moves. We have to change. We have to pivot. We have to absolutely move with the situation. Now, and so who knows what's going to happen in the next week? We hope and pray that we're moving in the right direction and everything, but we may very well have to change again. Now, from the standpoint of reopening our schools, it is imperative that we just do these things. And here is the biggest and most important parts of all, and that is just this. We will have total optionality. If you feel like that your child, should not be at the school, then we're going to make that child's education, along with all the children's education that choose not to come to the schools, virtual, and we will absolutely deliver a quality education to them for the time period that they decide not to come to the school. We will do the exact same thing with our teachers and our service personnel. We will work in buckets. We will work to educate our kids from the standpoint of whether it be in classroom, at the schools, or it be virtual. We will work with our teachers and our staff, and I've got two great people right here with me today, and they'll be elaborating on this more in just a second. We will work on a county-by-county basis with plans from our superintendents and our county boards as to what is the very best for our counties as we move forward. Now, we will absolutely watch numbers like you can't imagine. We will develop in the near days, and we're close right now, but I don't want to give you that development right yet. We will develop in the near days, and somewhere in the 10 to 14 day number, we will develop a code system, a code that will be green, yellow, orange, and red. And from that, what we will do is be able to look at a facility and say, this county has this level of the metric, and it is beyond what we think is acceptable for all students to be in school. And so therefore, or the school to be open. And so therefore, in that county, at that point in time, we will not have school being open. We will do it all virtually until we get the numbers down. We will challenge all of y'all in every county to do all you can possibly do to keep your numbers as low as we possibly can. Now, the measuring stick or the metric to be able to do that is the key. And that's the very thing that we're working on, to be able to get a fair and good, in fact, outstanding scientific, mathematical metric in which we can measure a county and say, we feel absolutely certain that this county is doing great, and we can proceed ahead with the school if people want to come to the school. And if people don't want their children to be in the schools, we have got to be able to service them from a standpoint of virtual as best we possibly can. And I'll get to that in just a second. We have to also look at what are we going to do with sports. And we're going to handle sports exactly the same way. When we get that measuring stick in your county, if you want your sports programs to move on and everything, some way, somehow, we got to keep the number down in the county. Now, and if we don't, then and the numbers are exploding to the upside, and you're red in your county at that point in time, and you happen to have a sports contest, that next day or that weekend or whatever like that, you're not going to be able to play. It's just that simple. We are not going to take a risk in taking kids and parents or whatever it may be to an area which is not having a problem and transmit that right to another area. And so what we're going to do is evaluate on a county by county basis. It's a gigantic undertaking. Now, in addition to that, which is probably the biggest thing that I have to announce today, well, there's lots of, the whole thing is enormous, to just tell you the honest truth. All counties will be required to submit their plans by August the 14th. All plans must provide for 5-day-a-week student engagement and have virtual school options. They must have plans in place to minimize exposure and have the best health practices possible, social distancing, face covering, hand washing, disinfectants, and on and on. All counties must provide a plan to continue to feed our children daily, regardless of the mode of instruction. Meaning that if we have kids at home, we have to have a plan to be able to get meals to those kids at home. Counties must also continue to provide support services for students so that students that need help will continue to receive it. The same thing goes for that. If in fact we have support services for kids that aren't in school, we've got to figure out how to be able to get that support services to them. And I've asked the Department of Education to assist with our county feeding plans, and I am committed to continue to make sure that we have resources to feed all the kids and absolutely do everything we possibly can to provide all those support services as well. Now, the next part of this whole program is just this. We have a new plan where we have basically committed $6 million to pull this off by September the 8th. And that is going to be our Kids Connect program. Kids Connect program. Today, I am committing to make sure that all students within the state of West Virginia are going to have access to our broadband. There's going to be 1,000 wireless locations in all 55 counties that we're going to install by September the 8th. That's what the $6 million is going towards. It'll be at all K through 12 schools, 32 higher ed schools, 255 libraries, and 31 state parks. Today, there's 40% of our state, that our kids can't get onto broadband. What this will enable them to do is go to one of these 1,000 locations that you see up there now, and what they'll be able to do is go into a parking lot or whatever it may be and get their assignments, get whatever they want, they need to get at that time. Now, imagine there are the most high-risk children that we have. In many ways, we have been out of contact with them for approaching 5 months now, and they need stuff. We need to be able to service our 30,000 kids in the special needs programs, whether it be occupational therapy or speech therapy or meals or whatever it may be. There's some good stuff going on. In addition to that, our Communities in Schools thing that I've been telling you about is an unbelievable program, and it's working and everything. Well, I think, if you were to ask these educators right behind me, they would say just this. They would say the kids that have been in communities and schools, meaning that someone is in contact with them and somebody's talking to them and somebody's encouraging them and helping them, they may have been better prepared in this pandemic than any of our other kids. So there's good stuff happening. The Kids Connect program will absolutely, ensure us to be able to have the broadband. And your first questions may be, well, what if the kids can't get there? What are we going to do if they can't get there? And the answer is real simple. We're going to provide bus transportation to get them there. That's all there is to it. That's what we've got to do. And we as educators, we've got to figure it out how to do it. How are we going to get our kids to practice, from the standpoint if they're going to sports practices or whatever it may be? We're going to do the same thing. How are we going to get our kids to band practice? We're going to do the same thing. We're going to send buses and we're going to have bus routes and everything where we can absolutely get our kids to these needs as best we possibly can and provide education for our kids going forward. Is it tough? Absolutely, it's tough. Is it expensive? There's nothing that is more important, in my opinion, than our kids. And so at the end of the day, we've just got to deal with it. Is there a playbook that tells us how to do this? Well, of course there's not. I've told you that over and over and over. Is there absolutely people that on one side are going to say this or this and whatever it may be? Sure. But at the end of the day, this is the very best program that I can possibly bring you with the guidance of all the education people and all the experts, and absolutely we will do it and we will do it correctly. Now, I want to fall back on just this, from the standpoint of our athletics and our sports. I've had many, many conversations with Bernie Dolan and the SSAC, and they're doing great work. All that's really, really good. I have not had a conversation in regard to this, what I'm going to talk about right now, but what happens? What happens if we play, if one team can only get in 6 games and another team can get in 8 games? How are we going to work this whole process and everything from the rating systems or whatever it may be? There's going to have to be a whole lot more effort made right now so that we can bring to you somewhere around the 14th of August how we're going to handle all the different aspects of the intricacies down in the weeds stuff that we have to do. Now, I would recommend, if it is all possible, to our SSAC that we bring in, maybe in conjunction with the rating systems that we already have, maybe something like a sports writer's vote, and maybe that works hand in hand, hand in glove with the rating system that we already have in place. There's all kinds of ways to do it. I'm sure the SSAC will achieve this, and we'll pull it off in as positive a way as we possibly can pull off. Again, I tell you just this, that if we get to a point in time where the school is closed and what we have is only virtual, at that point in time, with the school being closed, we don't play. We don't play sports if the school's closed. If the school's open, that means our numbers are down and we play. Now, I want to talk just a second to our private and our Christian schools. I want you to know that in this situation, at least in this situation, as should be in all situations, you are one size fits all with us. Meaning that the public schools and the private schools and the Christian schools, we want you to feel like that you are us and we are you. Now, from that standpoint, we know all the great work you do. It is phenomenal, the successes you have and everything, and we commend you in every way on that. I also know this. We've got $1.6 million that is in limbo and tied up in an escrow account that needs to come your way. That's all there is to it. The 1.6 million is sitting there from the standpoint of helping you be better prepared to reopen your schools as well. What we're going to do is just this: leave the 1.6 that's in escrow. We have found a way to fund that, and that money will flow to you immediately. The 1.6 million is sitting in escrow that is tied up in a lawsuit with Betsy DeVos and everything right now. Once that's settled, if it's settled and it's settled in your favor, in our favor for you, that additional 1.6 million will flow to you. And so from that standpoint, it could be a little bit of a windfall your way. Tickled to death for that to happen. That's good stuff as far as I'm concerned. Now, I want to talk to you just real quickly about two other things real fast. One is this. We have a situation all across this country, and it's surely here as well. But we have people that are scared to death because they're going to get evicted from their apartments or homes or whatever it may be. I would plead with those landlords, plead with them to not proceed down this course. I have done this with our federal government, and I have asked them repeatedly and everything, and what you've got going on right now is you've got Nancy Pelosi and you've got our federal government all, wrangling back and forth, and the people, the great people that are sitting there scared to death about maybe getting evicted from their home or their apartment or whatever. It's not fair and it's not right. And you've got people that are on unemployment and everything, and they're waiting because now their checks, and their payments are being somewhat suspended, those bonus dollars that they need, and they need very badly, and they are drivers to our economy. We absolutely need to help these people. And so from the standpoint of our landowners and landlords around, and maybe our banking system, please, I am pleading with you, please give these people a pass for right now. They need it. They really, really need it. You'll hear me end this up today about talking about how we care and how we are absolutely have to get more united together. I want to talk to you just a second because there's some people that run off into the wilderness with this thought that I've said. I did not say this, that we would start self-quarantining or start quarantining people for 14 days, if they went out of state and all that. Here's exactly what I said. And this is exactly what we have got to do. At some point in time, if this thing continues to explode to the worst and the worst side, at some point in time, and God forbid this to happen, please, but absolutely, if it continues to get worse and worse and worse, and our health experts continue to say, it's coming from the south, it's coming from the south, then what we may end up having to do is ask people to quarantine themselves until they are able to get a test and the test come back negative. Now, that's exactly what I said, and that's exactly what I mean, and it is only speculative and based on the fact that if things continue to get worse and worse, they're not continuing to get worse and worse, today at least. Just hang tight with me. We'll go through this real quick. We have free testing today in Raleigh, Hampshire. I'm sorry, free testing this week in Raleigh, Hampshire, Jackson, McDowell, and Taylor counties. Next week we'll be in Brook and Mingo. We urge the people on and on and on, whether you be asymptomatic or not, to get tested. From the standpoint of our grants going out to cities and the counties, we're approaching 70 million. 162 from the 162 cities and counties have applied. We encourage you to just absolutely keep applying, and we'll keep pumping the money out the door as fast as we possibly can and as fast as legitimate to be able to do so. From our summer feeding programs, we continue to do that at 696 sites. We don't want any West Virginians going hungry. Please take advantage of that. And if you have any problems, call 211. We have our census that it's up on the board and everything, and we absolutely, I continue to urge you to please get counted. Now we still have 4 counties and 4 we have outbreak in churches in 4 counties that are Mason, Grant, Logan, and Taylor counties. We have 89 cases that we're currently working and everything. Goes back to the same thing. We have got to absolutely continue to do the right things at church. Wear your mask, absolutely pew, in between, hygiene, social distance, all that stuff. It's really, really important. From a standpoint of our small business grants, we're moving very rapidly on that. We're pushing money right out the door. We want people to continue to apply. The more they apply and everything, the faster we'll get it out. We've got a lot of people working that really hard. Okay. I would just very quickly just kind of summarize a little bit on our communities. We all know that in a lot of instances, the safest place a kid can be is at school. We know the risk of what we're dealing with this virus and this killer. We absolutely know that if we have a bunch of kids that we're virtually teaching as well and everything, it will surely make the spacing situation better. We know that there's all kinds of people, from our health experts to all kinds of people from the education community, that are working to provide that place as the safest place and the best place to be. It is a place, too, that we can recognize trauma or abuse or neglect, and we can aid in helping kids if we have them where we can see them and we can get our eyes on them. Now, I also want to tell you just this, that I truly expect this food fight in Washington to end, and I truly expect another stimulus package that will bump us in the ability to aid and get more dollars out the door towards education and our safety and everything else. One thing I missed and everything, as I was telling you, those 1,000 points of light that are going to be all over our state now, where people can go and get basically Kids Connect, and where they can get into the broadband systems and everything, and we can truly have access in a way that is much better than we have today. That's just a Band-Aid as we move forward into broadband, from the standpoint of the days ahead, what's going to be announced in regard to broadband. But today, by September the 8th, that is the first step towards really, really, really helping. Now, I want to say this, from the standpoint of our kids, being able to have access to the equipment that they need, and I'm not sure, I'm looking real quickly here so that I'll not misspeak about laptops and tablets, but if they don't have a laptop or a tablet, what we're going to do is provide it for every single kid in this state that needs a laptop or a tablet. We're going to provide them that, and we're going to provide that through our school system, and they'll use it and then turn it back in and everything else. But we're going to make sure that our kids can get online and figure out what to do and continue their education. Now, last thing I'd tell you is just this, and this is a little off the subject, but it's important to me. I truly believe in our lives that God above is in charge of everything all the time. I think that in our lives, that we have big prayers and smaller prayers. And I would tell you this, that what we need more than anything that I can see is we need to continue in West Virginia to be the leader and lead not only our nation, but maybe even lead our world as to how we should think and how we really should behave. You know, we shouldn't be a state that is hung up on sound bites or divisiveness or politics. We shouldn't be that. In this situation of all situations, we need to be a state that is absolutely pulling the rope all the time together. We need to love one another as the good book tells us to love our neighbors. We absolutely need to know that we're going to make mistakes. And absolutely, as we go forward as neighbors, loving neighbors, we're going to make mistakes. I can tell you just this from the very, very, very bottom of my heart. I care and I love all you with everything in me. And I love this great state, like I said, probably beyond good sense. I want us to know that we cannot tear each other apart. We can't do that. We have got to move forward in every way. You know, in the last couple of days, I would ask you even just this, I would ask you to say a little prayer for a companion of mine. My bird dog Lily is in really critical shape and probably not going to make it. I spent 13 years with her walking across these crazy woods across the state and everything, and she brought a lot of happiness to me in every way. Those little prayers, the big prayers, us loving one another and doing the right things and making sure we get the big stuff right and making sure the little stuff doesn't come back to haunt us. Absolutely, that is the very thing that I would ask you from the bottom of my heart to do. Continue to pull the rope together and continue to be the miracle that you are. Absolutely, you are the best of the best, and that's exactly the way I think we should be. So God bless you in each and every way, and we're going to get through this, West Virginia. I'll promise you we're going to get there. Thank you.
All right, thank you, Governor. Let's now go to Clayton Birch, our State Superintendent of Schools.
Thank you very much. And Governor Justice, I think on behalf of our school superintendents and our State Board of Education, I think you do represent what I'm about to talk about today. It's hard not to rally behind the governor when he has such a caring heart. And he was clear with me on day one. Don't get me wrong. He provides quite a challenge sometimes of the expectations he lays out. But he's been clear from day one, and we continue to reiterate, we're going to do a few things. And one is, we will make sure it's healthy and safe. We will work with our health officials. Working around the clock with the governor and his staff, I will tell you that he, and I'm glad to hear he mention communities and schools. I think the First Lady, Mrs. Justice, being our champion for communities and schools, he's right. We were much more prepared. We were prepared to take care of the children that the schools are there to take care of. And he knows that since March 13th, it's been a lot of sleepless nights, and it has been a lot of myself, a lot of prayers, a lot of concern for the children that we don't have eyes on, the children that we hope are being fed and are taking advantage of the resources. But we have an initiative at the Department of Education we've actually based off of Governor Justice and First Lady Kathy Justice and the work they do in communities and schools. And everybody that has worked with me, all 55 county superintendents, know that the #1 priority entering school will be one caring adult. No matter what the mode is, whether it be virtual, in person, if something happens and those numbers do not decline and we are having to go to remote, the goal will be there will be one caring adult that those children will have, that we make sure that each and every one of our 265,000 children are taken care of, and that means meals. We made sure that every mode in the reentry plan includes meals, includes, you heard Governor Justice talk about student support services, and we are going to make sure that we are much, much more prepared than we were on March 13th. We're going to take care of these children in any way possible. He's even considering, you heard him talk, I just want to reiterate a few things about transportation, about making sure that if there are 1,000 sites that children can obtain access to Wi-Fi. We have to assist those families to make sure they have access. We want to create the most equitable education system we can during this crazy, crazy time. And even though we're in a pandemic, every one of us in the education field, the health field, and I know that we have partners here in higher education with Chancellor Tucker, we're going to make sure that every one of these children are taken care of. I'm so proud and to be a part of the announcement today for our private schools. I cannot thank our private school leaders who have reached out over the last couple of weeks to engage with me, my staff, the leadership in their counties, all in this together. We all have to make sure the communities are healthy and safe, and I just cannot thank our Christian and Catholic and private schools. I can't thank you enough. And for the governor to step up and make sure those resources are getting in the hands so that each and every one of our schools are ready, I'm completely impressed. I want to also talk about this map and the idea of tracking. I want to come back to, we knew that we would not allow schools to go in person if it wasn't safe. I can't thank Secretary Crouch and Clay Marsh and their staff on both sides. Just thank them enough for the time and effort. I know that they probably get a bit frustrated with the late night calls. I know that last night we were up quite late having this discussion about, what's the overall goal. And whatever those metrics are, I think the governor explained them very, very well. We want to make it very easy, very simple, but we also want to challenge the communities. The communities hold the key to making it safe for our children. If we can keep those numbers low, we can get our children back to the closest thing to normalcy we can. And that includes school, that includes sports, that includes all those activities that we all associate and services we associate with school. But we also know that if the numbers increase and we have to resort to remote learning, we've asked each and every county to have a contingency plan and be ready for that remote learning, so that if we don't resort back to a March 13th and it becoming a time of triage, but we really have a very careful plan to make sure children are fed, to make sure children receive support services, to make sure we're there for them on every day. But also be prepared that as those numbers come back down, there's light at the end of the tunnel. We're going to have a plan to open those schools back up and to re-enter. So again, on behalf of the West Virginia Board of Education, Governor Justice, each and every week I speak with each of the 55 county superintendents that are working each and every day on these reentry plans. I don't think that any of us can thank you enough for the leadership and support you've given us, and I just want to reiterate exemplifying that one caring adult that we want every one of these children to have.
All right, thank you, Clayton. Next, we'll go to Dr. Sarah Tucker, our Chancellor of the West Virginia Higher Education Policy Commission.
Good afternoon. During the spring semester, as our colleges and universities moved quickly to online classes, we knew that West Virginia's college students were facing challenges with accessing high-speed broadband. When we surveyed our college students, we found out that more than a third of them didn't have access to the internet at home. That meant that they weren't able to access their education, and that was simply unacceptable. We knew we needed a solution, and we needed it now, not in 6 months, not in 5 years. With this critical project, Governor Justice is filling an urgent need that will allow both K-12 and college students to complete schoolwork in convenient locations across the state. As we continue to work together on a long-term broadband solution for our communities, we are tremendously grateful that the governor has developed this immediate plan for students to access broadband close to home this fall. I thank him, and I thank our colleges and universities for jumping in to be part of this solution.
All right, thank you, Dr. Tucker. Now for a special presentation, we'll go to Pastor Matt Friend with Bible Center Church.
Thank you, Governor. Now, on behalf of the entire Bible Center Church family, I'm honored and grateful for the opportunity. And please know that we join you in prayer for those around our state who are hurting. First, I want to take a moment to say thank you to all the churches here in West Virginia who are serving their communities in Jesus' name. We're hearing inspiring stories of how you're rising up and loving in very practical ways. You're being billboards for gospel renewal. And so with the governor, I thank God for each of you. Furthermore, I want to remind us all of Jesus' words in the Sermon on the Mount when he said, "You are the salt of the earth, you are the light of the world. Let your light shine before others that they may see your good deeds and glorify your Father in heaven." Now, we know that Jesus is the ultimate light of the world. He lived that perfect life and suffered and died on the cross as a substitute for us. He rose again, ascended back into heaven, and gives forgiveness and righteousness and his spirit and eternal life to anyone who believes. But yet, thankfully, he invites us, believers, to join him in being light in our communities. And so finally, as for what the church can specifically do, I would encourage all churches in West Virginia to begin by listening to their communities. That's what we're trying to do. We're on the journey with you, still learning and growing. But we can ask the people near our churches what their greatest needs are at this time. You can ask, what's one thing that would make a difference in your life if our church was able to provide it? Now, no one church can meet all the needs. We all have limited resources, and we wish that we could meet every need. But listening has made a big difference for us. And at first, it led to a partnership with Mary C. Snow Elementary School, and then to teaching classes about basic employable skills like technology and driver's ed and floral design. And eventually it led to the 3D printing of face masks and face shields. But listening is helping us, and I think it would help all of our churches around the state. It's my privilege now to introduce our Executive Director of City Ministries, Michelle Thompson. Michelle models for us what it means to listen to the community. And so I'll ask you, Michelle, to go ahead and share a little bit about what's been going on here lately.
Thank you. It's a joy to be with you today, and it is a joy to serve our communities. As Pastor Matt said, my job is to love our city in the name of Jesus. Several years ago, but Bible Center decided that we were going to be for the gospel and for the city. And so to do that, as Matt was saying, we assessed our community and looked for gaps and for needs that we could meet. And then we did an inventory of our congregation to see what needs we could meet. So I would encourage other churches to do that. Don't try to be someone else. Be what your congregation is meant to be. And God comes through. He was ahead of us so much in this pandemic, in that we had started the Maker Center several years ago. The plans began, and it's an innovation center on Charleston's west side. But within it, we have a fully functioning wood shop, a technology lab, as well as an art studio. Little did we know that the technology lab and the art studio would come into play during a pandemic. But when the whole quarantine started, we immediately pivoted from teaching classes and hosting school children to printing personal protective equipment for our local medical professionals. And then in the art studio, we have sewing machines and sewing classes. So we were able to begin sewing masks to help those that work in the hospitals who were not necessarily front line with the patients. And I would just encourage each and every church to remember, God calls us in Jeremiah to seek the peace and the prosperity of our city, to pray to God for it. And that is our desire at Bible Center, but we also want to partner, do it with other churches, and to love our community in the name of Christ. And that's why we're here.
All right, thank you both. Next, we'll go to Dr. Clay Marsh, our coronavirus czar.
Wow, that's impossible to follow what we've heard so far in this briefing. And I think that the really inspiring thing to me is to hear of the commitment and service that each person who's spoken today really has in their heart for the state of West Virginia and for each citizen. As the governor said, we have some good news and we have some bad news. And the good news is that our RT, or reproductive score, is dropping lower, which means the virus is reducing its spread, which is good news. The bad news is that we still have a lot of communities with a high amount of COVID transmission. And we know that the southern counties are still areas that we are very concerned about. When we look around us and all the bordering states, we also notice over the last 7 days, the states around us have between 5 and 8 times as many cases of coronavirus per 100,000 population as we do. So we know that that spread back and forth is something that we have to be really cognizant of. as the governor has said, and certainly as Superintendent Birch has said, getting our children back in school and making sure it's safe is the number one priority that we all have, along with trying to make sure that we're reducing the community spread. And I think that it's really important to recognize that in other countries and in other states that have started to come back to school, then the amount of community spread turns out to be one of the very highest predictors of whether the schools can come back safely or not. And with all the mitigation measures, the masks, the distancing, and all the things that all the folks on Clayton Birch's team and for Superintendent Birch personally has done with lots of care, the piece that we really all have to be committed to is reducing the spread of coronavirus in our communities. And remember that in West Virginia and across the country, we're seeing the spread by younger and younger people. And as the governor said, we are very cognizant that even if we are not having as many people die, and we saw a little spike in the number of people that have died as a reminder to us of our vulnerable population, but we don't know what these long-term side effects of being infected with COVID-19 are. So for young people, as well as other people in the community, to get our liberties back, to get back in school, to get back in sports, to do the things we want to do safely, the key is really pay attention to how you are thinking of others and thinking of yourself. Wear your masks, stay distance, both. Both are really important right now. Wash your hands and make sure that if you're sick, you're not out with other people, because it is all of us together that will continue to make West Virginia a beacon for others, but also allow us to get back to the things that we value the most, being with each other. Thank you.
Thank you, Dr. Marsh. Bill Crouch and Dr. Ayn Amjad from the West Virginia DHHR, as well as Major General Hoyer from the West Virginia National Guard, are also joining us today and are available for questions. We'll now go to questions from members of the media. The first today is from Amanda Barron with WSAZ.
Hi, everybody. Amanda Barron from WSAZ. It's going to be enough of a struggle just to get back to school in whatever fashion it happens. Mental health is always a huge component of being at school. We know that there was a huge problem because of the opioid crisis prior to the pandemic. So with kids home alone and the stress of doing virtual school, isolation, with parents at work and parents being stressed out, how will mental health efforts be stepped up across the state to ensure that we don't lose these children in this capacity?
Secretary Krause, maybe you can start, and then Dr. Marsh or Dr. Amjad, y'all go from there, please.
Yes, Governor, thank you. That's a great question, Amanda. I've talked before about children being at home and many times being in situations that are not the best situation for them. Schools provide a valuable resource in terms of those eyes on by teachers who can make determinations and help with regard to filing reports for abuse and neglect. Those numbers went down significantly during the first couple of months of the pandemic, and we were very worried about that. I can tell you those numbers are back up almost to the level they were before the pandemic. So hopefully getting the word out in terms of toll-free numbers and information to other family members and individuals who could have eyes on those children have helped that. I'll try to provide some more information by next week in terms of those numbers and where we are and how that's changed. In terms of the mental health situation across the state, I've talked about our SUD population and the need for those individuals to have contact with their support group and individuals who can assist them through tough times. We have a couple of things we'll be announcing on with regard to SUD as well. Our folks have continued to push very hard to make sure services are out there where they're needed, and then we continue to support people who are in recovery or who we can get into recovery. So it's a great question. We'll try to provide more on that here in the next couple of weeks in terms of what we're doing, what we've been monitoring, and make sure that we give you that data as quickly as we can. So thank you.
All right, thank you, Amanda. Next, we'll go to Brad McElhenney with West Virginia Metro News.
Hi, Governor. Hi, Superintendent Birch. Hi, everyone. There are significant numbers of counties that have already submitted plans. And among them, for example, is Raleigh County, which has a plan for a hybrid approach to the return to school. Given today's guidance, will those counties have to adjust their plans in some way? Also, I'm wondering how long this latest guidance was in the making. Did it come up on a long call last night, or has it been in the making since a few weeks? Thank you.
Brad, let me say this. This plan has been in the making for a long, long time, and everybody's been working on it. And from the standpoint of the hybrid approach, I think we're fine and dandy. I think we're good there too. I may have misread that, but Superintendent Birch, if you'll jump on this, you can handle this a lot better than I.
No. I think that first and foremost, the timing of this plan, when September 8th was announced, and I continue to say Governor Justice was very clear with all of us, whether it be DHHR or the Department of Education, it was absolutely no joke. It was going to be healthy and safe. So a plan to make it healthy and safe has been in the works for quite some time. I do appreciate, again, Clay Marsh and the folks at DHHR, Secretary Crouch, General Hoyer, Dr. Amjad. There's just so many folks working on those metrics to make it safe. Now, Brad, to your point of the plans, yes, we absolutely, and I believe the governor has been very clear, as well as the State Board President Miller Hall. We encouraged each and every one of those counties to develop their plan based on our guidance. We want it to be locally driven, local decisions. And we actually support those blended hybrid models. They know what their communities need. And when this map is available, it will be a tool that they can use to maybe rethink when it's safe or they need to put further restrictions in place.
All right, thank you, Brad. Next, we'll go to Ryan Quinn with the Charleston Gazette-Mail.
Hey, Governor Justice, are you saying all school employees who only want to work from home will be allowed to? Kanawha said the other day even e-learning teachers would be required to show up to school unless some sort of undefined case-by-case exemptions were given to them. And then also, are you going to require masks of all kids of all ages unless they have like a medical reason exempting them? What about in the private schools? I know some counties have been wishy-washy on mandating this, but experts are recommending that.
Okay, Ryan, the first thing, to answer your question first, I'm saying no. I'm saying that all people will be required to work in some capacity. In regard to the mask, if I could just jump to the mask real quick, I think that's a subject that's still being kicked around a lot, from the standpoint that, there was a certain age of kids, maybe above 9 that could wear masks, and I think our health experts are saying now that it really, to the older kids, the older kids may be in a situation where we require masks there and everything, but I'm going to pass back to Superintendent Birch and everything and let him answer that a little bit better.
Sure. So first and foremost, we will have teachers, and I want to be very clear about everybody will be contributing. We expect that there will be a lot of flexibility. We're looking at the plans as they've come in. We're seeing an increase in need for teachers that might have to teach virtually. So I think there is a lot of flexibility, but when I use that term, one caring adult, we got to remember that our staff and teachers and service personnel, we got to make sure they need that one caring adult also. There's going to be folks that have health conditions or immune compromises, and we need to be flexible with them. We have quite a workforce that wants to engage, wants to contribute, and we need to be flexible with them. Now, as for the mask, we've recommended that we continue to follow what was already in place, and that was ages 9 and above. especially just good practices when children are in those congregate areas. We also are watching, as the governor said, and listening to Dr. Marsh. This is where that map may help us quite a bit. There may be some further restrictions we have to look at when the map's put out.
All right, thank you, Ryan. Next, we'll go to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I'm sorry to hear about your dog, Governor. I'm a dog owner. That's a tough thing. But a question about the wireless locations. Do we have that equipment already in hand, or is it something that we have to purchase and then put out in these 1,000 different locations? Logistically, will it be up and ready to go in the next 30 days or so, since we're starting school on the 8th? Thank you.
Sarah, you want to take this and everything? Sarah can do this better than I.
Happy to. We have assessed at all of the colleges, and the superintendent has done the same at K-12. In many of those locations, we have the equipment that we need, and in some of them we don't. And so we're going to have to put resources towards the ones that we don't, but we're not going to have to put those boxes out at all 1,000 places.
I think Chancellor Tucker has said it very clearly that we're doing an assessment. This comes back to one of those challenges that being on Governor Justice's team, I love being a team member, and I'll tell you what, it's one of those challenges that I think Chancellor Tucker and I absolutely took on and think it's so important, and we understand that it's a tight timeline, it's 30 days, but it's just so important to the students. I think we're all up to that challenge.
Gordon, you can come back to me. Listen, we've got to get it done. That's just all there is to it. I mean, this one is imperative that we get it done. It's a great, great, great idea. It's the idea of a culmination of a lot of different people. But absolutely, this is the idea that could really, really, drive us forward from the standpoint of where we are right now. It could absolutely aid in educating our children in West Virginia in a gigantic way. That's why we called it Kids Connect, and I think it's a great, great, great name. And so from the standpoint of Kids Connect, I thank all the people that came up with the idea and the thought, and now we just got to get it done. That's all there is to it. We got to get it done and pull it off, and we're all hands on deck to get that done.
All right, thank you, Kenny. Next, we'll go to Charles Young with WV News.
Hi, this is Charles Young with WV News. This kind of builds off Ryan's question. How are we weighing the individual decisions of teachers and employees versus the county plan? What happens if the county decides that we're going to have all in-person school, but all or the majority of the teachers say that they're not going to show up in person? How do we handle that?
Well, I'm definitely going to pass this to our educators, but I want to just say just this. We have to be considerate of our teachers. We have got to be considerate of our service personnel. And we've got to be considerate of our families. Now, here's what we can do. We can just do nothing. And from that standpoint, are we neglecting our kids or not? Are we neglecting all those special need kids that need support? Are we neglecting our kids, our families, and everything else? And what you have is you have division right now. You have one side thinking this, maybe another side thinking this. You have that divisiveness to some degree that I was talking about. So what do you do? What do you do if you're me? You try to solve it as best you can to accommodate everyone. You try to make it as best you can possibly make it. If we have a teacher that decides that she would rather not be there, then she's going to be able to aid and help from a virtual standpoint. That's great stuff. At the end of the day, our great educators, and these people, I mean, if you knew what I knew, I mean, for crying out loud, I've been a coach forever. I've been in every school in this state over and over and over almost. And absolutely, I am in the schools 5 months out of the year a whole bunch of time. I see them. I see what they do. I see exactly what they do. I see their hearts and their souls. Now, irregardless to what anybody may think, I think our teachers are good. And I think our teachers do a tremendous amount of good, and their hearts are big as the state of Texas. They want to help. They want to help. They don't want to in any way be part of the problem. They want to be part of the solution. Now, they're afraid in a lot of ways, and we respect that, and we're going to accommodate that. Now, I'm going to pass. I'm going to pass to Superintendent Birch.
Yeah, I think every one of our districts have taken into consideration that there will be teachers. If there are health issues, they're going to work with you. And we have so many families that are wanting to go to a virtual option. That's going to naturally change the makeup and the footprint within those schools. So there's going to be opportunities to be flexible. But at the end of the day, I agree with the governor. I think the majority of our teachers are service personnel. They want to be part of the solution. We know that a local principal here in Charleston has been very vocal on being ready and cannot wait to get back and continue that service mentality that we all in education have.
All right, thank you, Charles. Next, we'll go to Steve Adams with Ogden Newspapers.
Yes, this is Steve Adams of Ogden Newspapers, and I'm going to kind of change up the topic for a moment, but this is for Governor Justice and Major General Hoyer. But it came out earlier this week that President Trump, through a memorandum, was going, starting August 21st, every state except Florida and Texas, for whatever reason, instead of having their deployments of National Guard paid for 100% by the federal government, it was going to go down to a 75-25 split, with states and territories picking up that 25% price tag. I was wondering if we've had any conversations with the White House in regards to this. I'm curious as to what the cost would be to the state, especially if we have to pick up 25% of that tab. Obviously, the National Guard has been on the forefront of multiple missions in the state in regards to the coronavirus. I'm curious to know what type of impact that would have. Thank you.
Okay, Stephen, maybe I can lead off, and in general, you can jump in because you know this absolutely better than I. But I believe just this, Stephen. You know, I think that what our National Guard has done is unbelievable. And some way, somehow, if we've got to find the 25% of the dollars, we'll find it. But I would also say that I'm not supportive of that. And the reason I'm not supportive of that is just this, is we should absolutely, as a nation, as a whole, I mean, it's going to cost some money. Sure, it's going to cost some money. But at the end of the day, the messaging to me is, and it should always be just this, and that is that without any question, we should support our National Guard's effort because of what they have done for each and every one of us every blooming day. Now, I'll be on a call. I'm supposed to be on a call personally with the Secretary of Defense at 4:15 today. Maybe that call is being changed in a few minutes, but really 4:15 I'm supposed to be on the call. Now when I get on the call with him, I'll promise you I will emphatically express my opinion. But my opinion is just this, and that is these great people need supported all the time. And if we got to find the money in West Virginia, we'll find the money. But for crying out loud, to me, our nation needs to stand steadfast with our Guard because of the job they do every day.
Yeah, Stephen, I'll give you some numbers. At the height of the operation, we had 720 guardsmen on duty. We're down at about a steady state now of about 400 National Guardsmen, and that fluctuates depending on other training requirements. To maintain 400 guardsmen for the 132 days through the rest of the end of the calendar year, if the state of West Virginia had to pay a 25% share, it would cost us $7.26 million. We've been working diligently to address if we do need to address that, but as the governor said, he's been pretty adamant about going back and asking the federal government to revisit this. I just do want to point out too, and part of the reason that the governor and I pushed so hard for the federal status, the Title 32 status, is if we have a guardsman injured during this event, just like any other event, if they are in a state active duty status, then we have to focus on taking care of them under workers' compensation. It also limits their benefits and GI Bill benefits and other things. So the governor and I are both adamant that we continue the federal status, and we'll work hard to address the other financial issues.
All right, thank you, Steve. Next, we'll go to Mark Curtis with Nexstar Media.
Good afternoon, Governor and cabinet members. I've got a question about this school color coding system, having a system of green, yellow, orange, and red. How accessible is this going to be to the public? Will parents be able to look at it at a website like we can look at the dashboard at DHHR, and parents can make their own informed decision based on the color of the school on a given day? How transparent will this be, and who will be in charge of it?
Mark, I'm going to defer this to Clayton in just a second, but I want to just say this. Mark, I don't want anything in my administration that's not transparent, but especially I want this visible beyond belief. And the reason I do is because it will challenge all of us in each and every one of our communities and counties to try to keep those numbers low. And that's what we really need. We need any kind of additional motivation that we possibly can to keep our numbers down, because as we keep our numbers down in our communities and counties, we absolutely make our communities, counties, and our homes safer, and especially our schools. So Superintendent Birch, maybe you could jump in there too.
Well, Mark, the only thing I'll add is that just as the governor stated, this has to be very, very transparent. It will be housed. We'll be working directly with DHHR. It'll be visible to all. In fact, we're leaving it to our medical experts. They will have the metrics, but this green, yellow, orange, red, just as the governor stated, it will challenge the community. Once again, we know that our community is stronger when our schools are open, when our communities are able to engage in those extracurricular activities, and this is going to be a tool that can challenge the communities. One, to allow us all to know when it is safe and when it's reaching a point to where we have to reconsider school closure, but let's hope that what it does is actually the opposite. Let's hope that it challenges each and every one of us to do our part to keep those numbers as low as possible so we can enjoy those activities with school.
All right, thank you, Mark. Next, we'll go to Annie Moore with WVVA.
With a couple cases of COVID-19 at Southern Regional Jail, some inmates have raised concerns about not being able to get retested. Is there a plan to retest inmates at the facility?
Okay, Secretary Crouch or somebody from the medical team jump in on that, please.
Yeah, this is Bill, Governor. Absolutely, we're retesting everywhere we need to retest. We're testing employees who go, the guards who go in and out of the facility. Depending upon the outbreak, we test the entire area, the entire portion of that facility where the outbreak is, and in most instances, we've tested the entire facility. So where there's an outbreak, we follow that very closely, just as we do in nursing homes and other facilities of that nature. So we do that.
Let me jump right back. Annie, you got to keep in mind we've now tested 302,443 people in the state of West Virginia. So we've got to be heading towards a state at the top of the realm as far as the percentage of population that we've tested versus the other states in the country. I don't know where we rank, but we're surely up in the top realm. And so I am a real advocate of testing, and as long as we have the abilities to just continue to test, we're just going to keep continuing to do so.
All right, thank you, Annie. Next, we'll go to Dave Mistich with West Virginia Public Broadcasting.
Hi, Governor. Dave Mistich, West Virginia Public Broadcasting. My question is about whether or not there's going to be some kind of threshold to move to a different system. Is it going to be one case and schools shut down and we all go to virtual? Is it going to be 5 cases? Is it going to be 10 cases? Could you and the medical professionals explain that system a little bit better and how you arrived to that idea?
This one, and I'm going to jump in front of our medical people and say, this one we cannot give to you now because we do not have the metric, refined. We could give you, a lot of the ideas that are on the table, but that's worthless to do right at this time. That's why we've got to spend this next 10 to 14 days, and our medical community, along with our education department, along with DHHR, along with the experts, they have got to come to an absolute metric that gives us the ability to measure and gives it in a way that is as fair and accurate as we can possibly make it as we move forward, but we don't have that right now.
All right, thank you, Dave. Next, we'll go to Taylor Stuck with the Herald-Dispatch.
Hi, everyone. It's Taylor with the Herald-Dispatch. I was wondering if we could get some more information about the situation in Logan. And what does recovered mean? I've heard some reports from Logan that there are people who are being told they recovered, but they still are experiencing symptoms. So I was wondering if you could explain that to me and if there is an update on if there are any more cases at the hospital in Logan.
Okay, Dr. Amjad, this is you.
Governor, she had to step off.
Oh, okay. Well, then Clay, or Secretary Crouch, you're going to have to fill in here, or Clay, one of the two of you.
Yeah, maybe Bill, you start and I'll fill in.
Yes, sir. Thank you, Governor. Yes, we're monitoring Logan closely, and in fact, when the governor talks about testing, we charged to that situation, and we ended up testing 2 other nursing homes in Logan County. One of those, we detected 1 positive case, so we have an outbreak there that we're monitoring closely already. The hospital does have a few additional cases. They're at 26 staff right now and 7 patients. But let me mention, in terms of hospitals, both in Beckley and in Logan, they take care of these patients in a manner. It was a great question yesterday with regard to isolating those patients in a specific unit where everyone is safe. Most of these cases are travel-related cases, so the hospitals are part of the community, and when they have staff who interact with individuals who travel into West Virginia, as the governor said many times, from the South, they end up being infected. So, but the hospitals are doing a great job with that. We're still testing in Logan County. We have a variety of other facilities that we're looking at down there. We're trying to make sure that everywhere we have positive cases, we do contact tracing, and we make sure that individuals, additional individuals who need tested are tested, and those individuals that need to self-quarantine or isolate do that. So we're working very hard on that outbreak. We appreciate the question. Clay, you want to follow up with that?
I think I'll defer to Dr. Amjad, who's back on our call.
Sorry about that. Just had some internet problems there, but yeah, most of these places are doing okay as long as we can follow them along. And as Bill mentioned there, a lot of them are travel related, but Logan was doing well. I got to see them this weekend. The health department's doing a really good job of keeping track of everything. We'll follow them up this weekend. Later on this week, I'll say, and we're going to do some more testing down there and keeping up with them on a daily basis. I've been calling them as well as down in Princeton and keeping up with everything here in Raleigh County. And if anything has any more questions, we'll follow them up later on and keep up to date with them. But those are how everything's going. But everyone's doing a good job in keeping communications with the health department and with us. And we'll call them every day from now on. But I just got kicked off there for a second there. So sorry, Governor, to pass it along there. But I'm back on now. Happens in connections down here. But thanks.
All right, thank you, Taylor. Next, we'll go to Paul Mullen with WCBC.
Sorry to hear about Lily, Governor. Good afternoon, everyone. You have a full boat there today. Governor, I want to go back to government machinations. If you do get the 4th stimulus out of Washington, how soon would that money arrive in West Virginia? And when you make an order like to make the the funding available to the volunteer fire departments and rescue squads, how soon does that money go out and go to the rescue squads?
Okay, I only got the tail end of that question. Could you, I hate to have you go back through it, but could you please ask the question again?
Yeah, no problem at all. I wanted to know, when you get word that the fourth stimulus money is on the way, how soon do you have access to that money? And when you make an announcement like you did earlier a couple weeks ago, about volunteer fire departments and rescue squads getting money, how soon does that money go out? Do they have to fill out paperwork? Do you have to fill out paperwork, or does it go out right away or at the end of the month? How does that work?
Okay, here's, I mean, to the best of my abilities, let me answer the question about the stimulus package first, about the volunteer fire departments. And we want to also follow right up behind this with the EMS group. And so, and we're going to be following that very, very, very soon. But as far as pumping the money out to the volunteer fire department, I think you've got the same situation as just how fast do you get the small business loans out. And with that, you had applications and you had all kinds of stuff like this. The volunteer fire departments, we are just, we've got a little bit of a challenge because we're having to print checks in the auditor's department and everything, rather than just send the money out electronically, and that's a little bit of a problem. But it will go out very, very, very quickly, and we'll follow right behind that with the EMS stuff. Now, as far as the stimulus stuff, let me just tell you just this. Here's the way I think, what I think is going to happen, and I don't know how much of this you want to hear, but I think you're going to ultimately, as I've said a bunch of times, I think you're going to have, first of all, I've said we're going to have revenue replacement. We won't necessarily have just revenue replacement, but we will have more easing of guidelines that will enable us to go back and basically revenue replace. We absolutely, I think, will end up getting a few more dollars to the state. It won't be, I don't think it'll be as many dollars as came in the first go round of the CARES money that came. I think you will absolutely, from an individual standpoint, you will see the easing back of the bonus unemployment dollars, and those will be coming. You will see, like I said before, the changing of rules and everything. But as far as those dollars, how fast they get here, they came really fast from the federal government before and everything. The biggest things that we're looking for is just this, is how's the government going to treat the unemployment dollars? We have bucketed $678 million of the CARES go round the first time to ensure that our businesses are not going to get taxed heavier as we go forward in the future. We have an insurance policy like crazy right there. But if the federal government comes out and says we're going to forgive that, or forgive a portion of that, that's going to ease up more dollars to go to CARES that we can spend more dollars on within our state. Now, we've got to hurry because that CARES dollars are supposed to be, I think they're extending that date just a little bit, but it was December 30th before. Now, from the standpoint back to the unemployment, I think there'll be bonuses that will come, encouragement to come to get people to be encouraged to go back to work. But I think there'll be dollars that will be coming, to the tune of they'll probably split the baby on this and say, instead of 200, instead of 600, it's 400 or something like that. I think there'll be additional PPP, meaning the people in businesses that qualified for, I think, $1.7 billion in the state of West Virginia. If your business has been affected to the tune of where your revenues have dropped by below 50% level, I think you'll be eligible to apply again. So I think, I really believe, I'll be really shocked if we go into next week and we don't have a resolution of some kind, that'll be out there. But the biggest problem is just this: you've got a crazy food fight going on there in Washington, and that's, thank God I'm not there, because that's just, I think that's inexcusable, but I think that's what's going to happen.
All right, thank you, Paul. Our last question today is from David Beard with the Dominion Post.
Hi. with some schools going hybrid this year and not everyone possibly coming onto the K-12 campus, will you be rebooting the school clothing voucher program this year? If you are going to reboot it, when do you think it might be offered, and about how much would the vouchers be? Thanks.
Secretary Crouch, you've got to answer this one.
I will have to get some more information on that. I believe that program was extended, so I can get you those dates. But David, that's a good question, and I thought I had reported on that a couple of weeks ago. I will pull that back out, and we'll have that ready for Friday to make sure everybody's aware of that. But I am relatively sure that program was extended.
All right, thank you, David. Governor, back to you.
Okay. First thing, let me tell you this. Let me thank the people that mentioned, my bird dog Lily. Maybe it's a fault of mine, but I love our pets and everything, and I've been with Lily a long time, and she just, bless her heart, she's just like one of me, and so I really appreciate the people mentioning it and everything. I want to really especially thank Pastor Matt and Michelle. Because what a job and what a message you gave us again today, and an uplifting and inspiring message. And again, thank y'all so much for all the good work that you're doing and all the hard work you put in on all the stuff that you've been making for us. And it's just uplifting to hear you. And I thank you so much. I want to thank, our guest, Clayton and Sarah, because Clayton and Sarah are leading the charge from an education standpoint. And what an incredible job they're doing, and there's no absolute pat answer here to exactly what we ought to be doing, but I think what we're doing is we're trying to protect our kids, our teachers, our service personnel, all of our students in every way, and we're trying to absolutely continue to give them an education. Now, everyone should really listen to this. These decisions are really difficult decisions for all of us, but in thinking about everyone that's in this process, think about how difficult it is and how a no decision could very well be catastrophic. If the decision was, well, let's just don't do anything, let's just don't go back to school and whatever, let's don't educate, let's don't try to do what we're doing, the consequences of doing nothing are not going to be nothing. The consequences are going to be enormous, and we know that. So we're trying. That's what we're doing. We're trying to do everything within our power that we can do to make it as best that we can possibly make it. I don't know anything else we can do. Really and truly, when it really boils right down to it, what we are trying to do is connect people, give people choices, be absolutely respectful of everybody's health condition, and absolutely try to make it as safe as we possibly can make it, and help our kids from the standpoint of their special needs on down to everything, from the support standpoint to every single thing that is out there to do. Transportation to the wireless spots, transportation to a practice, absolutely the meals in every way that we don't let up on that. We're trying to do everything we can do and continue to educate our children. So in that, it's tough stuff. And I commend all those that are out there making those tough decisions, because you're really doing good work. And thank you so much for all you're doing. Thank you again, West Virginia, for all your prayers. Please especially remember these families. These families of the 7 we've lost today, and all the 124 that we've lost in the state. And absolutely, West Virginia, you can put it in the bank. We're going to get through this, and you're going to continue to be the miracle. I know you are in my heart. And absolutely, God bless each and every one of you. Thank you.